morning mga kasangbahay! Thank you for tuning in for today's episode. I'm your host, Dr. Barba-Cabodil. Another Sunday that will give full of knowledge when it comes to our health. Pero bago po ang lahat mga kasambahay, kayo po ay aming iniimbitahan na i-follow po and i-subscribe ang aming mga social media accounts. Please like and follow our Facebook page at www.facebook.com/DoctorsOnTV and like and subscribe to our YouTube channel. Just type www.youtube.com/@UNTV News and Rescue. And you can actually send us questions po and mga comments sa mga pages na yan. Naku, kaya after liking and subscribing, i-share nyo na din po sa inyong mga family and friends. Meanwhile, skin conscious ka ba? Hindi makalabas ng walang sunscreen. Naku aba, maigi po yan upang tayo ay makaiwas sa iba't ibang mga skin diseases. And naku, speaking of skin diseases, let's be informed sa kung ano-ano nga po ba ang mga klase ng sakit sa balat na maaari nating makuha kapag naku, hindi po natin iningatan ang ating balat. Naku, kaya panoorin po natin ito.
Non-melanoma skin cancers are often omitted from tumor registries on a global scale due to their widespread occurrence and relatively simple treatment. Yet, the clinical impact of cutaneous malignancies in low and middle-income countries, such as the Philippines, diverges from the global norm. Over the period of 2011 to 2021, the Philippine Dermatological Society documented a total of 2,102 cases of basal cell carcinomas and 614 cases of squamous cell carcinomas on their records. However, the absence of National Cancer Registry is likely to result in these numbers being underestimated.
Very good to know all about this, di ba mga kasambahay? Naku, kaya we need to start thinking about protecting our skin. Naku, kaya makinig po tayong mabuti sa ating mga tatalakayin, miya-miya po lamang. So stay tuned mga kasambahay. Doctors on TV will be right back. Welcome back to our show. Today, we'll be sharing some important details about skin cancer. And for introduction of our discussion, let's watch this.
Skin cancer is a type of cancer that originates in the skin cells. It occurs when the skin cells undergo genetic mutations that cause them to grow uncontrollably and form malignant tumors.
At para mas maintindihan po natin ito mga kasangbahay, we have invited a highly skilled dermatologist. As you all know, dermatology is a vital branch of medicine that deals with the diagnosis and treatment of conditions related to the skin, hair, and nails. And we are honored to introduce to you that our guest is also a section chief for micrographic surgery and cutaneous oncology. So without further ado, please join me in welcoming our guest, Dr. CLARE DIM-JAMORA from Makati Medical Center. Good morning, Dr. Krisi, and welcome to Doctors on TV.
Good morning, Dr. Sarah. Hello, mga kasangbahay.
Yes, and thank you po at pinaunlakan nyo kami, Doktora, na marami tayong matutulungan sa ating tatalakayin ngayong araw. And so let's get started, Doc. Can you please explain more to our viewers ano nga ba pag tinawag na skin cancer?
Okay. Unfortunately, yung skin cancer, as the name connotes, talagang bukol siya or tumor na cancerous sa balat.
Okay, so basically, alam natin ang skin, yan po yung outer covering ng ating katawan. Okay, so basically, ang skin cancer talagang makikita natin kapag meron siya.
Yes,
okay.
Exactly.
Hindi ho katulad ng ibang cancer sa ibang parte ng katawan na sometimes kung kailan malala na at saka lang
nakatago.
Ito
yes.
po, early on, may mapapansin na ang pasyente na merong skin cancer.
Exactly.
Okay.
Ayun ang pagkakaiba ng skin cancer compared to other kinds of cancer in the body. Usually for skin cancer, makikita natin siya on the outside. So, our skin is the biggest organ of the human body. So, usually if you have a mole or bagong nunal, or halimbawa may sugat na hindi gumagaling, you need to have it checked kasi pwede siyang skin cancer.
I see. Okay, and are there different types of skin cancer?
Yes. Ang pinaka-common na skin cancer ay tinatawag natin na basal cell carcinoma. The good thing about this condition, it's usually localized. So what they call yung stage 1 disease. when it shows, ang kailangan, importante lang dito is matanggal siya ng buo para hindi na siya umulit. The other types of skin cancer na common sa Filipinos is called squamous cell carcinoma, which is unfortunately pwedeng kumalat sa other parts ng katawan and pwede pumunta sa mga kolani or lymph nodes. Meron ding isang type of skin cancer tinatawag natin na melanoma. Unfortunately, itong type of skin cancer, ito yung nakakamatay. So kaya kailangan pag nakakita tayo ng nunal na nagdudugo or biglang lumalaki, kailangan isang gunin na natin ito sa isang dermatologist.
I see. And dun sa nga na-mention niyo po, you mentioned about basal cell carcinoma, squamous cell carcinoma, and yung melanoma. Sa kanilang tatlo, sino po yung mga common, based from your practice?
Yes. Usually, ang pinaka-common sa Pilipino ay ang basal cell carcinoma. Because maaraw sa Pilipinas, we are exposed to a lot of ultraviolet light, hindi natin nalalaman na nadadamage na pala yung skin natin. So, what happens is when you're exposed to ultraviolet light, you have breaks in the DNA of the skin. Pag bata tayo, yung breaks po na ito, nai-repair po siya ng katawan. Unfortunately, as we get older, there's a phenomenon na nangyayari. Ang tawag sa kanya is immunologic senescence. What happens is, hindi na na-regenerate ng cells ng balat natin. So, nagkakaroon na ng skin cancer. So, basically, cancer cells are different from normal cells in that hindi siya namamatay.
I see. So, dumadami sila. Patuloy-tuloy nag-multiply.
Yes.
Okay, and dun sa mga na-mention nyo pong different types of cancer, meron bang parang pwede tayong ibigay na hint sa ating mga viewers, like pag ito nakita nila most likely, baka masamang senyales ito and the like.
Yes. So usually a mole, a new mole or an old mole, nunal, na biglang lumalaki or halimbawa nagkakaroon ng sugat, those are bad signs. Also may tinatawag tayo na A, B, C, D, E. Ano ba to? So A is for asymmetry, meaning ang usual na mole or nunal ay pantay, bilog,
so kung ano yung nasa kaliwa, kanan, parang gano'n na itsura.
Pantay siya. B is for irregular border. So kung yung mga gilid niya ay hindi siya diretso, meaning parang it can be what we call scallop, yung parang seashells, hindi ito normal. C is for color. So if you have a mole that's black, brown, red, those are normal moles. Pero if you have a mole na suddenly black and brown, or meron nagkakaroon ng tan or white, then those are not normal moles.
Okay, so dapat bantayan yon. Okay, so that's C, color. Then now we move on to D.
Yes, D is for diameter. So if you have a mole that's bigger than the pencil eraser, 6 millimeters yun. So pag more than that, it should be consulted with your dermatologist.
Especially kung pagbigla ang paglaki.
Yes. So, ano ba usually yung paglaki? So, halimbawa, meron kang nunal. Since pagkabata, andun na siya. Tapos, suddenly, yung nunal na yon biglang tinatawag nilang nabuhay. So, meaning, within 2 to 3 months or 1 month pa lang, bigla na siyang umusbong. Or halimbawa, ito ay biglang dumugo. Then, those are bad signs. So, usually, melanoma, yung deadliest type of skin cancer, can actually occur in old and new moles.
Oh, okay. So, hindi tayo complacent na. Hindi ba? Ano to yung luma, okay, safe ako dito. So, pwede magkaroon ng changes eventually.
Exactly. So, some things na kinoconsider natin, halimbawa, meron tayong kamag-anak. Kasi ang Pilipino, we're mestizo, halo-halo tayo. May Chinese, may Spanish, may American, etc. So, meron tayong ninuno na nagkaroon ng skin cancer na melanoma. You can actually inherit that gene.
Oh, okay. So talaga may genetic predisposition pala.
Yes.
Okay, and dito sa tatlong klase ng cancer, Doc, lahat ba sila, they can you mentioned about basal cell carcinoma being localized, ibig sabihin doon lang. So, pero silang tatlo, pwedeng deeply, they can go into the, deep into the skin, kaya nila.
Yes, exactly. So, even if yung basal cell carcinoma is a localized type of skin cancer, it can actually penetrate because ang skin natin, different levels. So, yung epidermis, dermis, fat, and then you have your muscle, and then your bone. So, this kind of skin cancer, even if it's localized, can actually penetrate deep down to the nerves. So, kaya importante na pag meron palang bukol or may sugat sa balat, ikonsulta na natin agad. So,
I see.
you can actually prevent more expense. Kasi pag pumunta na siya sa ugat or pumunta na siya sa mga lymph nodes, etc., you will need further therapy.
And apart from that, syempre, we do not want naman yung worst prognosis. Di ba? Mas gusto natin maganda yung outcome ng pasyente. No?
Yes, exactly.
Yeah. And Doktora, kamusta po yung spread ng mga ito sa iba't ibang parte ng katawan? I mean, I mentioned yung basal nga po, local. How about yung dalawang klase? The squamous cell type and the melanoma?
Okay. So for squamous cell carcinoma and melanoma, the spread will actually depend on the location. So halimbawa, yung bukol na melanoma or squamous cell is on the head, usually neck, lymph nodes ang unang spread niya. So halimbawa, yung melanoma or squamous cell nasa likod, or nasa chest, or nasa arm, dun naman sa axillary lymph node. So ang pinaka nakakalungkot is pag umaabot na siya sa loob ng katawan, yung intrathoracic lymph nodes.
I see. Okay. And so talagang depende sa location ng primary lesion, ng primary tumor. And sa kanila, same po ba yung mga causes nila? I mean, ano yung usual cause po nitong mga cancer sa skin?
Okay. So usually, for basal cell carcinoma, the most common cause is ultraviolet radiation. So that's from sun exposure. For squamous cell, it is also ultraviolet light, pero you can have other causes, such as, halimbawa, masyadong nagluluto sa mainit, yung mga, or actually, may mga cultures tayo na, like sa mga Cordilleras, they always sit around a campfire.
Yeah.
Yung heat na yon can cause squamous cell irradiation. So also, those people who are exposed to X-ray radiation, massive amounts. So yung mga radiation technologists natin, kailangan mag-ingat for skin cancer.
I see. And how about the risk factors po? Meron po bang mga individuals who are more predisposed? I mean, of course, apart from dun sa mga more exposed po sa UV, no? So meron bang like group of individuals who have higher risk in having any of these cancers?
Exactly. So usually, the lighter the skin, more prone to ultraviolet light damage. So yung, for example, may mga Filipinos na, di ba iba naman ang color natin, pwedeng skin phototype 3 until skin phototype 6. So meaning, yung talagang super fair until yung talagang mga kaibigan natin na medyo may pigmentation. So, the lighter the skin, the less the pigmentation and coverage on the skin. So, more likely na magkaroon ng ultraviolet light damage.
Okay, so talagang God is fair. Kasi di ba parang, lalo na tayo mga Pilipino, naku, dami sa atin gusto lahat naiinggit sa mga mapuputi. Pero actually, dapat mahalin natin. Diba? Oo, di ba? Mas nasa advantageous part ang mga morena. Kasi the dark pigment pala actually of
protective.
Protective siya. So mas malbaba yung risk natin of having skin cancer.
Exactly.
Okay, and ito, Doktora, upon coming of a patient na who probably has skin cancer, I mean, in your practice, medyo, paano mo siya, alam mo na siya na cancer, Doktora, medyo sa kasanayan niyo po, and how do you usually diagnose this?
So, usually, yung mga patients na merong skin cancer or suspicion of skin cancer, we can do first what we call dermoscopy. So, it's actually a special device that we use to illuminate the skin up to the second level. Next is what we call a biopsy. So, biopsy is getting a piece of tissue from the skin, tapos pinapadala po natin to sa laboratory for pathologic diagnosis.
Okay, and usually ano yung mga dapat i-expect ng mga patients na, who has undergone a skin biopsy, during the procedure and after that?
Yes, so usually this procedure is done using local anesthetic. So
numb naman pala. Manhid, so walang dapat ikatakot sa pain.
Yes, there's no pain, so don't be worried. It should be completely numb before the biopsy is done, and then the doctor will give you pain medications, a topical antibiotic if necessary, and then wound care instructions. So simple to follow, and usually it will heal in about a few days.
Okay, and usually the results will be out in how many days?
Yes, so usually at our facility, we have the result in about 1 week.
Okay, so basically, yung agony of waiting is not that long naman, diba?
Yes.
I mean, sa bagay kung ganyan na nga katagal nandyan yung tumor, okay? So more so, hindi ka pa ba makakapag-intay ng another week, diba?
Yes.
At least alam mo na at alam na din ng doctor how to manage you perfectly, no? Depending on the result of the biopsy. And how about, are there any other risks, okay, when biopsy is being performed?
Okay, because this is cutting into the skin, so even if it's small, there is a risk of infection.
Yeah.
So, kaya kailangan to keep the area clean. Also, make sure that your blood sugar is controlled because often the skin cancers happen in older individuals. So, kailangan hindi siya ma-infect.
Yeah. Especially ang mga older individuals, may mga comorbidities.
Yes.
There's
diabetes.
Who usually, these patients usually have poor wound healing, di ba, doktora? Okay, and apart from the biopsy, ano pa, do you still have other tests pa na ginagawa? I mean, to rule out other possibilities?
Okay, depending on the biopsy result, we may need to do a CT scan. So, PET CT scan can also be done. So, that's very specific for melanoma and for squamous cell carcinoma.
Okay, so I mean, of course, maganda rin sa PET CT. I mean, pwedeng may makita kung meron kumbaga naka-metastasize na or nakalipat na, namasyal ang cancer cells sa ibang parte ng katawan, di ba, doktora? And yung usual, I mean, like yung mga viewers natin, kung kunyari meron sila, apart from that, ano pa yung mga sinasama niyo po sa list ng mga ibang mga requests?
So, usually, we'll order for blood tests also. So, wag kayong matatakot kung sabihin ng doktor, kailangan natin ng blood test. It's just really to find out if there can be spread to other parts of the body. What we call a oncologic profile or oncologic tests.
I see. Okay, naku, napakalawak pala ng usaping ito. Makasambahay na ko, kaya kailangan po maging attentive tayo para po maiwasan ang misconception. But for now, let's take a short break. Doctors on TV will be right back. Welcome back, mga kasangbahay! Now, for the continuity of our discussion, we will discuss the prevention and treatment of skin cancer. So, Dr. KRISINDA here will talk about the prevention first. Okay, so, Doctora, is there a way to prevent skin cancer?
Yes, Doc Sarah. Actually, nobody has to get skin cancer. The best way is actually to prevent sun exposure direct. So, meaning avoid the sun between 10 a.m. and 4 p.m. Covering up, so wearing a hat, sunscreen, sunglasses, lip balm with SPF also. So,
I see.
Clothing din. So, kahit na let's say nasa labas tayo, nag-garden, or halimbawa nagsasaka, nagtatanim, magsuot tayo ng t-shirt na medyo mahaba yung sleeves.
Or simply, avoid getting under the sun. Okay,
Direct sun,
kaya lang,
yes.
Direct sun. Kaya lang, syempre, di ba, lalo na kung work-related, hindi naman natin mapipigilan yung mga ibang individuals. Of course, kailangan nila maghanap buhay.
Yes, exactly. So, yung mga tao na nasa field, so halimbawa, mga vendors or mga engineers, construction, kailangan talaga magsuot ng sombrero. Kasi yun naman, di ba, pwede naman ma-protect yung upper part of the face. Then, mag-sunscreen.
I see. Okay. So, na-mention natin talaga, ganun talagang katindi yung correlation between skin cancer and yung sun exposure. Now, does it mean po na usually ang skin cancer, kung magkakaroon ng isang tao, usually dun sa, like, mas exposed sa sun? Mas common siya? Yes,
Doktora. Yes. Usually, mas common siya sa sun-exposed areas. Usually on the face, yung matatangos ng ilong, sa ilong, or halimbawa palaging nasa beach, sa likod, or sa shoulders. So, the more sun exposure on any part of the body, the higher the risk for skin cancer.
Naku, kaya pala dapat, the more they engage into these outdoor activities, the more na pinapacheck nila yung kanilang katawan. Okay, chine-check nila kung may mga changes, di ba? Okay, so doktora, now, with regards naman sa treatment, paano po tinitreat ang skin cancer?
There are actually many ways to treat skin cancer depending on the type and also the level of invasion. Okay. So, meron tayong tinatawag na TNF yung staging natin. So, depends on the stage. If it's just localized, stage 1, usually surgery can be curative. However, if lymph nodes are involved, you will need to consult an oncologist kasi baka kailangan na ng chemotherapy, or
Okay.
even radiation oncologist, because that will require radiation on the draining lymph nodes.
I see. How about the prognosis, Doktora? Or yung ibig sabihin po nito, outcome po after the treatment of skin cancer?
Exactly. So, the less the stage, the better the prognosis. So, meaning if it's a stage 1 disease, the higher the rate of cure. So, we want that. However, when you reach stage 3B, meaning involved ang lymph nodes, or stage 4, meaning unfortunately kumalat na sa ibang parte ng katawan, then we have to counsel the patient and the family on other types of treatment.
I see. And ito po, pag may treatment, what should the patient do to be ready for this treatment po?
Okay. The most important is to prepare the body. So, a healthy body can fight cancer cells more.
Yeah.
And the healthy body will be able to undergo chemotherapy and radiation. So, we need to have a nutritious diet. So, very good balanced diet. Important yung integrative type of medicine, because vitamins are also essential to healing. So, as well as eating fruits and vegetables.
Okay, so, Doktora, but you know, at what point that skin cancer is no longer curable? Kasi syempre, di ba, nakakalungkot that you mentioned, of course, the prognosis will also always depend dun sa type, yung severity po, yung staging, no? And of course, yung siguro kung nakakalat na siya. But in your practice, sa mga nakita nyo sa inyong mga patients, when do you actually say na hindi na siya curable?
So usually, kapag napakalaki na nung body ang affected, unfortunately, even in this day and age, may ibang mga patients na dumadating, nakain na yung kanilang mga face. So even if we want to do surgery, it's no longer possible. Or halimbawa, yung melanoma kumalat na sa buong katawan, then that's more of palliation. We don't expect complete cure anymore.
So basically, supportive na lang ito sa mga sa mga ating patient na ganito yung condition, okay? And okay, so kung hindi mag-treat, probably ganito rin po yung outcome.
Yes. So we need to work also with palliative care for pain management, and also for nutrition management as well.
I see. And okay, Doktora, in the event na na-treat yung skin cancer, okay, so does the same patient get to have another episode of skin cancer, probably in another site in the body?
Yes. So if you have a patient who has a skin cancer before 50 years old, there's a greater likelihood that that same person will get a second skin cancer on any part of the body that's exposed to the sun.
I see. So basically, dapat pag it's really lifestyle modification,
yes,
Doktora,
exactly.
no? Okay, so upon diagnosis. And mas maganda nga, kung kunyari, alam na natin to, very informative naman, like yung ganitong show. And then, syempre, marami na rin tayo nakikita sa social media. There's internet, no? So, alam na natin yung mga predisposing factors. So, might as well, you know, we have to really follow itong mga guidelines na to, just so we don't have this. But in the event na nagkameron nga po, I mean, how often should one get his or her skin checked?
Usually, if you don't have any family history, you have to have your skin checked at least once a year. But what you can do at home is to ask your partner to look at your back, examine if there are any abnormal moles, and then go in front of a mirror and look at your face, your neck, and then the front of your body at least once a month.
Oh, okay. Kasi hindi mo mapapansin kung may changes kung hindi mo regularly ginagawa.
Exactly.
Okay, but you know, many individuals, they don't really have regular dermatologists. So, kanino sila pwedeng pumunta para dito sa mga skin checkups na to? Kasi we understand, di ba, there are different types of dermatologists also.
Yes. So,
like, maganda yung katulad sa inyo, may expertise na ganito. Can you explain further?
Exactly. So, you should see a dermatologist who's very sanay with diseases of the skin, hair, and nails. So, please consult a dermatologist from the Philippine Dermatological Society. Okay,
and you have your subspec, no, with that's like with regards to cancer, tama, Doktora?
Yes. So my subspecialty is in most micrographic surgery and also procedural dermatology.
Okay, and okay, going back to the patients, Doktora, no, do they need like any further tests after na kunyari natapos na yung treatments? I mean, di ba po yung, especially pag diagnose ng cancer, kahit anong cancer, dapat yan regularly nagpapacheck. How often should they do it? Para to ensure na, you know, walang recurrence.
Exactly. So usually for skin cancer patients and skin cancer survivors, we recommend a checkup every 3 months for the first 2 years. And then after that, every year. So minimum checkup is 5 years. So I always send them back to the referring dermatologist. So that way, they can see the patient locally. Because a lot of the patients come from out of town. So they do need to be seen regularly. So we can catch anything sa any part of the body.
Kasi that's so ethical of you, Doktora. Ha? And of course, ito, Doktora, marami din kasing takot with regards sa management ng skin cancer. So, they're afraid of mga side effects, ganyan. So, usually, ano yung mga common side effects during the treatment of skin cancer?
So, usually, the more common side effects, if we're talking about radiation treatment, would be localized effects. So, that would be redness, dryness, burning sensation, mga blisters. So, you also need the dermatologist to help you manage the skin problems that come with that. Also, if you're undergoing chemotherapy for skin cancer, your skin tends to dry, your hair falls, nahuhulog yung buhok, or nagiging parang medyo gray yung skin. So, you need to moisturize more often, and then also make sure that you take care of your scalp while the hairs are falling. So, nourish the scalp with moisturizers as well.
Grabe, very well said, Doktora. You know, thank you for all your generous inputs. Very comprehensive yung binahagi niyo sa ating mga viewers. And with that, Doktora, baka meron kayong final words for them?
Okay, so skin cancer doesn't have to be deadly. If you see anything wrong with your skin or there's something suspicious, see a dermatologist right away.
Okay, and you might want to invite them here at Makati Medical Center.
So please, if you have any skin issues, we have more than 30 dermatologists here at Makati Medical Center who can help you with your skin, hair, and nail problems.
I want to thank our esteemed guest, Dr. KRISINDA Claire DIM-JAMORA, a dermatologist from Makati Medical Center, for sharing her expertise and knowledge with us on this very important topic. Ako, bago po tayo magtapos sa ating episode, gusto rin po naming maibahagi ang iba pang kaalaman para tayo ay magkaroon ng healthy skin. We all know that what we put into our bodies affect how we look and feel, and that includes our skin. At naku, para po sa mga detalye, panoorin po natin ito.
Good morning mga kasangbahay. Today, pag-uusapan natin on how we can protect the largest part of our body, the skin, o ang ating mga balat. Lalo na at pabago-bago ang panahon ngayon. Madalas ay sobrang tirik ang araw at bigla-bigla namang uulan. Kaya naman mahalaga na papangalagaan natin ang ating balat and have a glowing complexion in a natural way. Ang pagkain ng mga prutas at gulay, lalo na ang carrots, ay maganda sa ating balat dahil mayaman ito sa beta-carotene na tumutulong para protektahan ang ating balat sa delikadong ultraviolet radiation na gagaling po sa araw at pwedeng maging sanhi ng skin cancer. Ang pagkain din po ng prutas tulad ng avocado ay isa sa mga best dietary source of glutathione, an important antioxidant. Avocados are also excellent source of vitamin E and a good source of vitamin C, kaya maganda ito para sa ating balat. Bukod dyan, mahalaga din ang pagkakaroon ng maayos na sleeping pattern. Ugaliing matulog ng 7 hanggang 8 oras dahil pinapasigla po nito ang ating balat. During this overnight process, you also build collagen and elastin, the molecules responsible for skin elasticity, keeping your skin firm and helps prevent premature aging. Ang pagpapaaraw sa tamang oras din po mga kasambahay ay malaki ang maitutulong sa ating balat dahil nakakatulong ang vitamin D upang panatilihing healthy and glowing ang ating balat. Umiwas din po tayo sa sobrang init na sikat ng araw dahil maraming hindi magandang dulot ito sa ating balat. Kung hindi may iwasan ay maglagay tayo ng sunscreen lotion na merong SPF 50 to help protect against sunburn and most importantly, prevent skin cancer. Ayan mga kasambahay, simple lang di ba? Pero malaki ang maitutulong sa atin kung susundin natin ang mga tips na to para panatilihing healthy ang ating balat. See you again next week for more natural tips. Muli, ako si Jason Sanchez, your integrative medicine doctor. Please follow me on my social media accounts. Jason Sanchez, Doc J. Because natural is beautiful, only here at Naturally Yours.
Mga kasambahay, kasambahay, sana ay marami po kayong natutunan ngayong araw sa ating mga tinalakay. But before we say goodbye, I just want to greet Iyo and Iya, yung aking kambal, si EJ, si Doc Alain, and of course, Nanay and Tatay. I love and miss you very much. Well, that's all the time we have for today. We hope that you would incorporate the tips and advice shared today into your daily routine to maintain a healthy lifestyle. And hope to see you all again next week, God willing. Muli po, maraming salamat po sa inyong lahat. Ito po si Dr. Sara Barba-Cabodil. Let's make it a habit to learn about good health. Only here at Doctors on TV.
We would like to thank Makati Medical Center, a hospital with a heart, located at Amarsolo Street, Legazpi Village, Makati City. You may contact them at 632-8888-8999. Like and follow their Facebook page at I Am Makati Med, or you can visit their website at www.makatimed.net.ph. Makati Med Wellness Center, located at 7th floor Ayala North Exchange Tower 1, Legazpi Village, Makati City. Mestiza soaps. Mestiza soaps are made with natural ingredients and a combination of vegetable and fruit extracts, which can be also used by children and pregnant women. Good news is that these beauty products are vegan and cruelty-free. For inquiries and orders, contact 0969-175-4231-33 or 02-8824-5217 or 02-881-30320. Organic acai. Support your health with a 100% organic superfood supplement, Organic Acai Premium Blend and acai freeze-dried capsules. Rich in powerful antioxidants, fiber, amino acids, vitamin C, omega fats, and other essential nutrients the body needs to help build stronger immunity against illnesses and help increase your energy. Organic acai is available in all Mercury drugstores and other leading drugstores and supermarkets nationwide. Linden Gas Corporation, located at 179 National Road, Landayan, San Pedro, Laguna 4023. For inquiries, you may contact them at 02-8824-0867 or 02-824-9360, or you can email them at lgcsalesco@gmail.com. And of course, salamat sa ating partner, ang DepEd Santa Rosa, sa pakikiisa sa ating atikain na maibahagi ang kaalamang pangkalusugan. Clinica Figura. You may contact them at 0917-317-7272. Medical Depot. Healthy Nom Nom Food. Barba-Cabodil Holistic Health Group, located at Unit 1531, Centurion Medical Makati, Century City, Makati. You may contact 0917-317-7272 for appointments and other inquiries about your health and wellness needs. Please like and follow Facebook page, Dr. Sara Barba-Cabodil. Special thanks to Dr. Gia Grace B. Sison, Head of Makati Med Wellness Center. Attorney Pilar Nenuga P. Almira, President and CEO. Dr. Saturnino P. Javier, Medical Director. Ms. Arlene L. Sonco, Senior Vice President. Ms. Monica Reyes Dizon, Assistant Vice President. Mr. Mark Funelas, Unit Head Manager, Communications and Special Projects.